Have you ever wondered what it takes to diagnose a disease? What goes on behind those seemingly simple words "you have been diagnosed with"? That can change someone's life forever. Today we will delve into the principles of medical diagnosis, where science meets intuition. In the vast landscape of medicine, diagnosis is the compass that guides the course of treatment. It is the process of determining which disease or condition explains a person's symptoms and signs. It is often challenging, as many signs and symptoms are non-specific. A medical practitioner primarily utilizes three tools for diagnosis: a patient's history, physical examination, and medical tests. Each plays a vital role in piecing together the puzzle of a patient's health condition. The patient's history is a narrative of their health. It includes the patient's complaints, known as symptoms, and the history of present illness, past medical history, family history, and social history. Each detail, no matter how minute, could be a clue leading to the correct diagnosis. Next comes the physical examination. It is a methodical examination of the patient's body, starting from the general appearance and progressing to more specific examinations. It is not merely a tactile process, but a visual and auditory one as well. The pallor of the skin, the rhythm of the heart, the sound of the lungs, each can tell a story of what lies within. Finally, we have medical tests. These are the tools that provide a more objective view of the patient's health. Blood tests, imaging studies, biopsies, these allow us to see beyond the surface, to understand the inner workings of the body. These three tools, when wielded correctly, lead us to a diagnosis, but it's not always as straightforward as it seems. Sometimes the pieces of the puzzle don't fit neatly together. Sometimes a symptom can point to multiple diseases. Sometimes a test result can lead us down the wrong path. It is in these moments that a doctor's clinical acumen and experience come into play. To summarize, diagnosing a disease is a complex process. It involves collecting and interpreting information from the patient's history, physical examination, and medical tests. It requires both scientific knowledge and clinical intuition. It is a journey, often filled with uncertainty and challenges, but one that ultimately leads to understanding and healing. So the next time you hear the words, "you have been diagnosed with," remember the journey that led to those words. Remember the tools that were used, the clues that were gathered, and the knowledge and intuition that were applied. Because behind every diagnosis, there is a story of science and perseverance.